Thank you, colleagues. I very much appreciate your consideration of AB 463 to bring more transparency to our recent skyrocketing of the cost of specialty drugs. I first want to thank the committee staff and at the outset accept their proposed amendments. I know there's been a lot of discussion about this topic. Let me first start with some facts and statistics. First of all, this bill, we're not talking about aspirin or Tylenol. We're talking about high-end specialty drugs. Drugs that cost at least $10,000 per treatment, drug prices which have been exploding under our watch today. This past year, drug price inflation has tripled. The highest inflation rate this past decade, 13%. Over the past 4 years, the median price of drugs has increased by eightfold, from $1,200 to $9,300. I think, colleagues, you're all familiar with the example of Sovaldi's hepatitis C. $1,000 per pill, $84,000 a treatment, $300 million into this year's budget as proposed by Governor Brown. That amount of money is only going to serve 3,000 patients. We have 750,000 Californians who've been diagnosed with hepatitis C. $300 million, we know, could not only backfill all of the Medicaid cuts we're talking about, it could go an awful long way toward additional appropriations, education, etc. Now, this is not just, though, about hepatitis C. 70% of the new FDA drug approvals last year are specialty drugs. We have 12 new blockbusters that are expected this year. In the next 8 years, they're expecting specialty drug spending to quadruple from about $90 billion in 2012 to $400 billion in 2020. Now, the pricing for drugs has been very puzzling. I think you've all heard that it often costs us far less to fly patients from California to other countries than to have them treated here. Sovaldi's Hep C, for example, in the United States, $84,000. If you were to go to India or Egypt, it would cost you $900, 1% of the cost of Hep C treatment here. The cost to manufacture that drug, $150. Now, the drug industry has said that prices are high because of their research and development costs, and if that's the case, that is what this bill addresses. What this bill says and asks for, it's very simple. For high-end specialty drugs that cost more than $10,000 per treatment, we want to provide public disclosure, public transparency of the costs of research and development, manufacturing, advertising, subsidies, etc. Now, the industry has raised a number of concerns, and I'm happy that we have addressed these with the amendments. And again, I want to thank the committee staff and the chair for suggesting them. We have amendments to protect any proprietary or confidential data. We have amendments that allow drug companies to report on costs of failed drugs, of basic science research. We have an amendment that says you don't have to go all the way back into time, 20, 25 years. You only need to go back for what general accounting principles of 7 years suggest. As healthcare's costs have gone up, we have tackled healthcare costs in every other area with cost transparency. Doctors are required to report costs to Medicare. Hospitals are required to report costs to OSHPD. Health plans are required to report medical loss and profit ratios under the ACA. But we haven't done this in the area of drug costs. We need to do this for our constituents, our patients, health consumers, as well as cities, counties, and states.